My doctor prescribed Acor. Acor is this real enigma to me because it's by far the most valuable source of information on kidney cancer and many other cancers, but you can't find it on Google because it's a crummy old ASCII listserv. It's not even HTML email with attachments. And yet, they're generating terrific value. Somebody mentioned earlier today, patient communities are basically free. Well, this is a real paradox too, because they may be close to free compared to $2.4 trillion. Yeah, that's less than a rounding error, even compared to the stimulus money, that's a rounding error. But Acor at Christmas last year tried to raise 100 grand to keep the doors open and the lights on for a little bit more with their servers. They were only able to raise 20 grand. Seriously, think about this. 1% for the patients, whatever we spend on other things, patients can do a lot of good with a little bit of money. And then finally, I set up a support community on CaringBridge for my family and friends. As you know, if you've had a crisis like this happen, you end up with a big communication burden. Everybody wants to know what's the update, what's the latest CAT scan show and everything. With CaringBridge, I post a daily update whenever I want to. People get an email notification. My support went viral. I had people from college and eventually from high school that I hadn't heard from in decades who showed up and gave me support. Notice what's happening here. Genuine value is being generated outside of the ecosystem that we talk about. I discussed this with Jason this morning. I've discussed it with him before. This is our conventional view of the healthcare industry, healthcare economics, right? From one of his slides. Meanwhile, what we all are out there doing when our butts are on the line is this: social dynamics or groundswell view of things. Notice that there is no connection from there. What I found on Acor is information that did not exist on any medical website, even the best ones, including what's the latest on the best treatments, what's the latest on side effects, things like that. So the question from a business practitioner standpoint is, how do you establish an influential role in these consumer conversations? Because what we want to do, obviously, is we want to avoid being commoditized. We want consumers to respect what we offer and see value in it. And if those discussions are happening down there, you've got to be in there and you've got to be effective. Just to come back to my story, the treatment worked. Yay, Novartis, yay, interleukin. That's the before and after picture. That's a slice of my chest with one of the other tumors down there and what it was like afterwards. Good stuff. So now, this is a real-life example. The patient becomes an influencer. I started a blog just to teach. I called it The New Life of Patient Dave. I had already been participating on blogs under the name Patient Dave before I got sick. So I started The New Life of Patient Dave. Later, I discovered e-patients and called myself e-Patient Dave. I'm a marketing guy. I rebranded, right? Opportunistically. Seriously. So I started writing on other blogs. I discovered this group and became one of them. Next thing, contribute to my hospital's outreach, right? So there's a video of me down there. They asked me, would you be willing to be in a 5-minute testimonial video? Now, this was one that was produced by a professional video production crew, contrary to Lee's method. So we did that, and that's good. They put it on their renal tumor website. But then I got questions from people in my Acor community. One real problem is access to reliable information about what surgical options are available. In my case, you know, when you have your kidney taken out, there are 2 ways to do it. They can cut out a rib permanently, which is painful, and then cut through 4 layers of muscle, pull out the stuff, and it's 6 to 12 weeks to recover. I didn't have that time to spend recovering before the treatment could start. Laparoscopically, I was out of bed in 2 days and home in 3. And we were ready to go. So I just using a crummy social recording site, Blog Talk Radio, I did a very amateurish recording with my surgeon about surgical options. Then I did one later on about medical options because patients often aren't told about interleukin, which saved my butt. This was driven by patient questions. It was my idea, not the hospital's. The cost of the hospital was 0, and this converts to other currencies also. Now, sometimes I outdo them. The people at the hospital said, okay, well, thank you for this crummy audio. We're going to take it into our production studio in the back room and snip it up and make something better. 3 months later, they came back and said, could we put your blog on our website? So that's what they're doing now. They're leveraging what's already out there. The production values were not so hot, but authenticity, 100%, okay? That's the key message here. Authenticity is what drives this. Whatever we do, don't screw it up, okay? Don't pretend you're somebody you're not. Don't impersonate. Don't try to hide what you're doing. There is no need for that. That's the thing, folks. You know, we know in these industries a whole lot of useful information on how to get better and so on. Just be upfront and be real, contribute value, and be known for being real and contributing value. In a sense, this is direct-to-consumer marketing without the spend. You know, you're there in the swimming pool, swimming around in those pipes with people, having the message get across. Protect your reputation, because once it's shot, the game is over. As one final thing, I want to just share how this unfolds in a real person's life. This is me 3 days before I had that shoulder x-ray. This is a guy who was dying of cancer and didn't know it, okay, at a New Year's Eve event. This is me 10 months later at the company Halloween party, having beat the Reaper, as I said in Firesign Theater. I had pictured my mother's face at my funeral. Well, here's my mother's face at my daughter's wedding this May, which is fabulous. Here's me walking her down the aisle, and then something else bizarre happened. And I had this thought when I first put this slide together a while ago. I didn't know exactly what was going on, but I heard the explanation today. This June, for the first time in my adult life, I said to my wife, I want a bike. This is very odd, because this is like me all of a sudden realizing I want pickle ice cream. It's like, no. So I went and got a bike, a $40 yard sale bike, and I rode it until I was tired of riding in the neighborhood. I found a park to ride in, found a rail trail, went out and got a bigger bike. One day, I rode this 12-mile rail trail, and I said to my wife when she picked me up at the other end, I said, I'm not done. And I ended up riding 30 miles that day. And so then I went home and I signed up for my hospital's 25-mile cancer fundraiser. That's me and my bone surgeon, right? And I raised $1,250. Now, for me to do this is not who I am, and yet now it is. And by the way, I am so respectful of the grim nature of a nearly fatal disease that I went and got a magic marker, and I wrote on my incision on my leg, cut here, and showed it to the surgeon. They didn't think it was particularly noteworthy. They do that all the time. So here's my point. There is something to this patient engagement stuff. It is changing the nature of the interaction. If we can hook into it and learn how to do it effectively, we can really alter the nature of care delivery, and that's a really good thing. Engage authentically, earn people's love, and be known. Thanks very much.